Mhm.
Ahora sí ya.
Hello, Cathy. Good morning. This is Hugo Ruiz. Hello.
Hello. Hola.
Good morning. This is Hugo Ruiz. How are you? Are you ready?
I'm ready.
Okay. Okay. Thank you very much. We really appreciate your contribution to the Congress and, and to share all your experience in the clinical management of diseases of marsupials. And when you want, you can start with your conference.
Okay.
Okay.
All right. I think we're ready. Buenos dias, everyone, and thank you for coming. I hope that I can share some information with you today about all my experience. There were a lot of them with marsupials, but obviously we could go on many of these topics for hours. So I've kind of condensed it down into some things that I hope will give you some insight as to working with these wonderful creatures. My objectives for this presentation are to give you an overview of some of the differences in anatomy and physiology that are clinically important, some basic biological data, some things about their behavior, and some basic diet and husbandry things that we need to worry about in captivity, because obviously keeping marsupials that are essentially a wild animal in captivity has its own conditions. We're going to talk a little bit about some of the major clinical things that I see, and some about the diagnostics and treatments for them, a little bit about emergency care, and then we'll kind of sum it all up and see where we go from there. So the number one that we see probably is the Virginia opossum, Didelphis virginiana. It's native to North America. It was east of the Mississippi River and east of the Rockies, basically, and also migrates down through Mexico. However, they transplanted a population to Southern California years ago, and that population has migrated up the West Coast all the way into British Columbia. It isn't in Eastern Washington, but it is in Western Washington, and we see a lot of Virginia opossums here. A fairly common marsupial that is the other New World opossum is Monodelphis domestica, or the little short-tailed opossum, or gray opossum, or Brazilian opossum, depending on which publication you read. They are used as a laboratory animal, and we'll talk a bit more about that when it happens, but they're also in the pet trade. The one that is for now the non-native ones that we'll talk about are the old world marsupials, which have invaded the pet and the zoo community. The major one for that is the sugar glider, which is native to Australia and part of New Guinea, and it should be housed. It's a social animal. It needs to be housed as more than one, which kind of makes for problems as a pet. It's used as an animal model for the study of human clinical depression, and all you have to do is house it solitarily and it will go into serotonin deficient clinical depression. The wallabies that we see primarily are the Bennett's wallaby, or the red-necked wallaby, which has two different names in the literature, Macropus rufogriseus and Notomacropus rufogriseus. They started out in the zoo community, but there were zoo extras, and so they are quite a popular pet. They're from Tasmania originally, so they can tolerate cooler and even wetter environments. And then the Tamarodama wallaby from Western Australia and South Australia, Kangaroo Island, and it's a very popular wallaby because it's very small, and you can pick it up and and hold it kind of. It's not much bigger than a small dog. And then some people have wallaroos, and then the kangaroos, the principal ones are the reds and the grays. And that's my exam room in my clinic with two large eastern gray kangaroos lying in the exam room. And you can see they're pretty darn good size. This is the bench. Not for the faint of heart to handle those guys. Some of the anatomy that we'll talk about in marsupials that's kind of unique. First of all, they don't have an umbilical. They are, raised outside the body. Marsupials give birth to a fetus, not a fully formed animal. They are mammals, but there's two groups of mammals: the marsupials and the placental. And one of the differences is the presence of marsupial bones, which are these pelvic ribs that come out. They are not to support the pouch because males have them too, and not all marsupials have marsupial bones. One thing they do have is a bifid penis and a bifid clitoris, and the urethra, where they urinate, is out of here, not out of the ends of the penis. They have a very unique female reproductive anatomy, which I'll show you a picture of later. And the scrotum is kind of in the mid part of their body for the males, on a stalk. They're very different that way, but you get over it. The Virginia opossum never really fuses its growth plates on its bones. It slows way down on growth, but it continues to grow throughout life. They consider marsupial metabolism to be lower than placental mammals, but that's not completely true, because small marsupials have metabolism at the same level as a placental mammal of that same size. It's around 150 grams. They're pretty much equal. So the one characteristic definition of marsupial is it gives birth to a fetus. It isn't the marsupial bones. It's not a pouch, because some of them don't have pouches. Some of them don't have marsupial bones. It's that they give birth to a fetus. And that's very important, because it gives us a chance to watch development outside the body. They do have a cloaca rather than a separate anus, reproductive tract, and urinary tract orifice. It's more like a bird in that different things empty into it, and the cloaca itself moves to expel the feces or expel the urine, so stuff doesn't mix. Virginia opossums are nocturnal, and they do have a tapetum in the back of their eyes. So when they, headlights of a car see them, you get that bright flash. That's the reflective material in the back of their retina. And they have these anal glands that are around the vent. And for a Virginia opossum gets hit or they get scared, they let loose with this material, and it smells like they're already dead. So it's a really good defensive thing, but it's not really good if you have them as a house pet and they let loose with this stuff. Most of the time, our pet opossums do not. They're really good about it. I'm sorry, when we switch to this format, some of our pictures are kind of overlapping the text. I don't know how to fix that at this point, but anyway, the biological data that's important for these guys is that they can have 2 reproductive cycles a year if the conditions are right. So they can have 2 litters a year. The opossum can have fairly large litters. They can have anywhere from 2 to 16 or more sometimes. They have a lot of teeth. One thing that's common to marsupials is they usually have more upper incisors than they do lower incisors. And we'll really take a look at this in sugar gliders and the wallabies. But the Virginia opossums have more upper incisors than lower as well. The adult males are about 4 to 5 kilograms. The adult females are about 2. This is in the wild. In captivity, they can get much chubbier than that. Um, like I said, we have usually 1 litter per year, but they can have 2, and the record is 20 offspring. Um, they do go into estrus, which lasts about a month. Um, and during that time when they're in estrus in the spring or in later in the summer, if they have a second cycle, they are often very restless and they pace a lot. And their gestation, though, see, is 12 to 13 days, and then they give birth to that little fetus that makes its way to the pouch and hooks onto a nipple and develops there. Um, Interesting to note is that their whiskers develop before their eyes open. So they can already discern things by touch. And another thing in the pouch, many marsupials, the fetus, the babies, are can tolerate a lot higher carbon dioxide than adults and certainly placental mammals can, which again the pouch environment is not got a lot of good circulation, so they do tolerate that. um, let's go forward here. um, I wanted to show a picture of those anal sacs. They sit, this is a vent, this is the cloaca, and these anal sacs sit on either side and they can get fairly large, and the little ducts to them are right here. And they will, in a pet opossum or one that is neutered or spayed, they may get impacted because they're not expressing them all the time. So anyway, that's a clinical issue that we have to deal with, and they smell really bad when you have to clean them out. Um, a lot of our Virginia opossums are, when if they're raised by humans, are quite cuddly. They're quite sweet. Some of them don't ever want to be pets. A lot of them want to be pets. They're not aggressive. Basically, they are a latrine animal. They pick a corner or papers or a litter box to defecate and urinate on, and they're pretty good about using it. They can climb trees, they can climb stuff in your house. The whole thing about babies hanging from their tails, yeah, not really. And the adults certainly can't. Their tail is semi-prehensile, but they can't hang from it. They weigh too much. They'll eat a lot of things. They're really motivated by food. They have several different vocalizations, but generally they're pretty quiet. They do a hiss, they have a growl, and the males, particularly when they are searching for a female, they do this click thing. They do, and you'll hear them walking around going. Um, it's just sort of weird. Anyway, when you're feeding an opossum, basically they will eat any given quantity of anything if they like it, which is not good when you have a pet opossum that gets extremely obese. This is a quantity for an adult female opossum. It's quite small. They get fed in the evening. You really have to limit their diet. In the wild, they're omnivorous. They eat carrion, they eat insects, they eat vegetation, fruit, snails, and slugs are a favorite. But in captivity, we actually do have a couple of diets that are really good. One of them is to use the omnivore diet by Missouri. The other one is by a company called Reliable Protein Products, and it's an insectivore diet. We also use low-fat yogurt, various different fruits and vegetables, always supplemented with calcium. Um, and we feed them in the evening with a controlled portion, not huge amounts like Claire here. This is Daisy, and she's getting a small amount. Water available always, big heavy crock dish. But some of them will also use the drinker tubes, the sipper tube bottles. Most of them, they like the big bowl. Be sure it's one they can't tip over because they will make a mess. This is a cage set up for captivity for 2 pet opossums actually lived in here. This is my bathroom. Okay. This is one type of a ferret cage that we adapted and made a nest box out of. Not my favorite kind of ferret cage, but it worked really well for the opossums. The opossums were loose in the bathroom. The door was always open. They could also run around the house, and they never got into anything or destroyed anything, unlike the ferrets. So you can let them roam the house. They don't cause any problem. Um, In the wild, um, an opossum lives 2 winters. In captivity, we get them up sometimes 5+ winters. We do have cancer problems after that period of time, but they can live much longer. They Your normal house temperatures are fine for these guys, and the normal house humidity is fine. What's comfortable for us is comfortable for the opossum, basically. Um, okay, so what do we see the most with them is probably the emergencies because they've been hit by a car. Let's face it, if your defensive behavior is to freeze, open your mouth, and look scary, and then fall over, a car doesn't respect that and will go right over them. So it doesn't work well, and we see a lot of car hit by cars. And one thing is that the opossum, the mom especially, will not survive. Stop, pull the body over to the side of the road, and check for pouch babies. Sometimes too, check the surrounding area if you find one, because they could have climbed out of her and wandered off. And those are usually the ones that we end up raising. If the pouch babies are furred, you have a really good chance of raising them. If they're not furred yet, it is very, very difficult. It can be done, but it's really difficult. The other kinds of trauma that we see a lot of is fight wounds or attacks from other animals, dogs, coyotes in our area, raccoons even. Um, it's mainly coyotes and pet dogs that get them. And they will occasionally, other opossums will fight, but for the most part, the opossums will just snap at each other and they run away. But we see, the tails chomped off and various different wounds. And so your treatment, first of all, is like anything else and any other animal, is to stop bleeding and prevent shock. So everyone who works with opossums and does rehab and does rescue should learn how to give subcutaneous fluids. And we give them to them in the flank down here on the side because there's lots of loose skin, and then should alleviate any pain, because they do feel pain just like we do, and we do know doses of medications to alleviate that pain. This is just briefly some of the information that I have, that I work with rehab people and rescues, and we have a combination of things that we usually use. First thing is midazolam to remove any anxiety, because they're scared and we don't want them to be. We want them to relax. And then we give them a pain medication, and there are several different ones that they've worked out pretty good pain responses with. One thing that you can in an opossum that you have a hard time getting close to and you want to calm it down, you can squirt Valium or midazolam into their nose or into the cloaca, and it will start having effect. So you don't have to give them a shot. You can squirt it into their nose, and it will start to calm them down. You have to assume they're infected and sick, so we start them on amoxicillin, which works really well in these guys. Their tail has veins on the side and also the bottom, and depending on how fat the tail is going to kind of mandate which vein you can get into. You can also draw vein from their or blood from their arm. That works really well. They have a quite large arm, forearm vein. That's the one I usually put catheter in to give them fluids during surgery or whatever. It works fine. They, like I said, in order to do blood draws, do take x-rays, do any kind of diagnostic work like that, I usually give them some butorphanol midazolam combination, and then they relax and you can do whatever you need to do, because otherwise the first thing they do when you pick them up is they will poop, and it's really nasty. And this way too, if you relax them like this, they're not struggling and they're not scared while you're taking blood or whatever. I do a lot of ultrasound exams in opossums, and I don't end up sedating them for that because they don't seem to care, and it doesn't hurt or anything. If you're going to give injections, it's very similar to that of any other small animal. You want to give it the flank area for the sub-Q. For intramuscular, we usually use the front of the thigh, and then that IV again, I usually use the cephalic, but other people use other veins. Okay, one of the biggest problems that we have with Virginia opossums is people trying to raise the babies and they don't know what the correct food is. And then even with the adults, they feed them cat food or foods that really are not appropriate. And so the biggest thing we get is metabolic bone disease. And as you can see here, the bones are all bent and twisted. And this one is kind of broken and bent, and the bones look very bizarre. And this is, hey, there's a marsupial rib. Okay. Um, we diagnose this by x-rays, but also you can obviously feel and see this. A lot of these guys, because of this dietary problem, have severe kidney and liver problems. The treatment obviously is to start with some calcium, give them calcium gluconate, give them oral, give them in fluids if you can. And you fix the diet, and you also need to relieve the pain, because it really hurts to walk when your bones are all bent like that. And then you check the kidney, and then you fix the diet on these guys. Most changes like this are going to be permanent, and they can live with them as long as you relieve pain and stuff. This is again a very fat opossum pet named Claire. Um, she learned how to open all the cupboards in their house and go scrounging for food at night, and the garbage and the dog food, and she'd pull food out of their rabbit's cage. I mean, Claire would eat everything. Um, we have a big problem with heart disease in our captive opossums, and they have various different forms of heart disease. This is a very dilated heart, and we diagnose them with radiographs, and then I also do cardiac workup with ultrasound and ECG, and even blood pressure on these guys, and they have all the same problems that every other kind of animal does. It's been pretty well worked up. The treatments, luckily, are very similar to those that we use in other mammals for the same kinds of problems. And not surprisingly, I guess, the dosages are pretty much the same, which is really great because, obviously their bodies work the same as placental bodies, and the drugs do the same thing. So it's very handy. But an awful lot of our older opossums, if they're over the age of 2.5, 3 years old, they're probably going to have some degree of heart disease and need to be treated. Another thing that you probably read about a lot is called crispy ear, or it's a cutaneous vasculitis. Dermal septic necrosis, and it's usually a strep or a staph, and it can be in the ears. It can also be anywhere else on their body, tails, you name it, toes, and it is actually an inflammation of the blood vessels. So one of the things you want to do is treat for that inflammation of the blood vessels and get all the swelling and stuff under control. Pentoxifylline is a great drug for opening up blood vessels. And then definitely do your work on figuring out exactly which bacteria is causing the biggest problem. The other thing is, we start empirically with amoxicillin, but it may not be the best antibiotic. Your testing will tell you. And then we treat with buprenorphine because this hurts. Ears are very very sensitive, and that's nasty and it hurts. And then a lot of times I actually treat with a vasodilator for their whole body. And if they're running high blood pressure, they actually get a blood pressure medication to lower them. I've also used the therapeutic laser on them a lot and massage to get those blood vessels back in order. I didn't know where else to put this, but I wanted to show you what sort of impacted anal sac looks like when you squish it out. It's green. It smells really bad. Wear gloves, but a lot of our pet opossums are going to have to do this because these things get really big and they're very uncomfortable and they start kind of rubbing their butts on stuff and you need to express the anal sac. So that's what it looks like. Most of them do, sorry, my cat is helping. Most of our Virginia opossums do have various different intestinal parasites and even a lungworm. There are several different medications we can use. We tend to rotate them and continue to treat them for a while, like the first year of life, every 3-4 months, just because we don't know what they've got completely. We do fecal exams on them, but that may not tell us the whole story. If they've had a lot of fleas, they probably got the dog tapeworm, so we treat them for that. And then fleas. I mean, fleas is a big problem for a lot of these guys, and we treat them with the same, like cat medications, the topicals, at the same dosage that we use in the cats for the body weight. As far as ticks go, one of the really, I guess it's a cool thing about opossums is opossums eat ticks. They will pull them off. You won't find ticks on the opossum, but they eat ticks off of like dead bodies of things, and help to control some of the really awful diseases that ticks carry. So raising babies. This was supposed to animate, but didn't work. Anyway, baby opossums, um, when they're little, you usually have to assume that they are septicemic, that they're extremely infected because chances are they were suckling from their dead mother. Um, they're usually dehydrated when you rescue them. They're also hypothermic. They're low body temperature, and we warm them up. You got to get the fleas off of them and all that good stuff. And then feed them correctly, get a body weight on them, and start tracking weight on them. Once they're eating well on their own, that's when we can start using some of the cat flea medications, but I don't usually start that until I know for sure that they're not septic and that they're eating really well and they're well hydrated and they're really cute when they're little. Um, Feeding baby opossums is difficult, and it is crucial to use the right formula. And remember that the milk in a marsupial's pouch changes throughout the development of the fetus. It starts out much higher in fat, and then it goes to much lower in fat and total solids. There are some diets that have been worked up. National Possum Society, Dr. Anita Henness worked up some fabulous diets for opossums. There's also good information about hand rearing them in Lori Gage's book on it. But essentially that we use a partner. I'm sorry, I can't move. Whoa, sorry. I can't move the picture out of the way. But there is a formula that you can start with that's kind of generic, which is using Espalap and multi-milk. It is in this book, but it is going to change throughout their life, and that's why, if you haven't raised them before, we could do a whole lecture on how to raise baby opossums because it is difficult. It's not as simple as you think it is. Okay. So that's pretty much my wrap up on Virginia opossums. The next one that we see a lot of, and they're very popular as pets, are sugar gliders. And sugar gliders have a gliding membrane from their wrist to their ankle. It's called a patagium, and they glide. They can't fly. They jump from tree to tree and fly. They have very big lower incisors that are designed to gouge trees and get sap to run off. Then they flip upside down, they wait for the bugs to come up, and they lick the bugs off of the sap. They also, those incisors are really good at gouging your fingers and causing them to bleed. And the sugar gliders kind of like the taste of that blood. So just a warning. Don't cut them, however, even though they look like rat teeth, because they don't grow back. They're very social. They live in a family group, mom, dad, kids, twins usually in the pouch. Last litters, twins, the kids, which were probably the year before, and then sometimes the ones from the year before that are still hanging around. They all help raise the little kids because they get into a lot of trouble, and then they migrate off as they think. But there's a family unit, and they're noisy, they're nocturnal, they make a lot of screaming and yelling. Trying to have them in your home and then making all that racket at night, yeah, it's like not my idea of fun. But anyway, people love them. They're very cute. They do urine mark and scent mark. And so they are kind of smelly. Anyway, um, this is what I wanted to talk to you about a little bit about the female reproductive system in a marsupial. And this holds basically for all of them, which is, it's different than the placental mammals because of the development is different. So in a placental mammal, you have this goes pretty much to the outside. This is the vagina, right? This is the uterus. Here's the ovaries. This is the cervix here. And we have, placental mammals have one vagina that goes down. Well, marsupials have three, basically. They have two laterals and a central, because the ureters come down here and in development got to get to the bladder. The only way they can do that is they split the reproductive system, which is just really weird, but that's marsupials. It's hard to catheterize a bladder in a marsupial. You can do it using an endoscope or whatever, and you got to get up there and you got to go through the central thing and get up in a curve and get into the bladder. It's just not quite the same, but this is their really weird thing. If you're going to do a spay, for all of you veterinarians out there, there are things written up about how you remove this all the way down here, and an awful lot of those end up damaging the ureters, and the possum or the marsupial dies of renal failure. We just usually take off the uterus. We just do it right here. We just spay them. We remove that. Oops, sorry. They have a bifid clitoris. And normally when a fetus comes down, the fetus will come down here. They think the sperm is stored in the lateral canals, but that may not always be true. In the kangaroos, it probably is because they're always pregnant, but not so much in the other ones. So this is the male I was talking about, this stalk that kind of comes from the middle of their abdomen. And this is this bifid penis again, which does not deliver. The sperm goes along the outside of it, not the inside of it. It's just a weird organ. The sugar glider stomach anatomy is very simple, but they do have a big cecum for fermenting the gums that they eat. So in captivity, you need to give them a product called gum arabic that you mix up from a powder so that they have some stuff to ferment. And they really need that rather than just feeding them something horrible like cat food, which is not appropriate. Okay, sugar glider body. I think you can see this patagium stretched across here. It's kind of, head, chest, heart. It's a body. This is what these lower incisors look like. Here are the two bottom incisors, and here are all these little upper incisors. Don't cut these. They don't grow back, but they can do some damage to your fingers. Here's a sugar glider skull. They have really big eyes in proportion because they're nocturnal. And then they have that classic, it looks like way more teeth for their jaw. That's very characteristic of marsupials. A sugar glider behavior. This is a scent gland on the males. They develop this big bald spot that they use to wipe on the females and everything else in your house. They also have this, what they call a gular, or on their chest scent gland, that can make smelling. This is expressing what non-impacted paracloacal scent glands look like in a sugar glider. And this is, there are 8 glands around the vent that they can use to scent your house with. So, and that's both sexes, both male and female have them, so they can be kind of smelly. Um, Ideally, you need to give them a huge room. You need to give them a lot of space to fly around. This is actually in the Northern Territory of Australia, some zoo outbreeds, and what they would do to feed them. This is big nest box. This is a whole family on each side. They put up a light to attract insects, and the gliders just sit there and pick off the bugs. And they don't eat like a moth. They'll rip off the legs and rip off wings and just munch on the body. So you want a big area. They do need to be kept warm. These guys are from a very warm environment. Your house temperature is too cold. They need heat. And they do need to be, really, they do need to be in a family. You need groups of them. We know what they eat in the wild. They've done lots of studies on these guys. We know they eat different things all year round. We know that they eat the nectar, they eat plant exudate, and then times of the year they eat a lot of bugs and a lot of protein, and sometimes out of the year they lick this sugar stuff off of leaves, and they eat all sorts of bugs. However, in captivity, we can't do that quite the same. So what the Australians have done, is they worked up for their Leadbetter's possum conservation program. They did an analysis of the different nectars and the different foods. The Leadbetter's possum is also a pitara. It's in the same group, same family. So they figured out this Leadbetter's formula, and it is really good. There's a whole bunch of stuff on the internet where people have changed the recipe and fussed with it and basically made a mess out of it. They've ruined it. Don't go to the internet to get Leadbetters. Go with the straight Leadbetters diet. The formula for their nectar, it works beautifully. But a lot of that stuff on the internet doesn't. So we give them the Leadbetter's diet is about 50%, and then we give them an insectivore carnivore type diet. And again, not cat food, not ferret food, not dog food. We have the Missouri omnivore, we have the reliable protein products, insectivore diet, which I've used for years along with Leadbetters in these guys. There's a whole bunch of stuff on the internet. Avoid it. When you feed them at night, these are squirrel gliders, same group, but this is the only picture I've ever gotten that was focused of them doing. You put the dishes, you hang them, and they flip upside down to drink this stuff because remember what they do in the wild is they gouge a tree and then they flip upside down and they wait for the ants and stuff to come running up to the sap and grab the bugs. So they will eat like this. We do give them some different insects that we gut load, we feed, we add calcium to them, try to stay away from things like mealworms and, superworms and all that. They're just awful. We do supplement with pollen. We may give them a tiny bit of fruit, but chop it all up, fruits and veggies, so they can't pick out their favorite part, because these guys will just pick out the sweet stuff if you give them the chance. That's why they're called sugar gliders. But it's not because they eat table sugar or really fruit. The sugar that they eat in the wild is from the nectar and the pollen in the flowers that they lick. So it's not the same. You give them a lot of, but stay off the internet, because they've just really messed up their diets. We do use the lorikeet nectar, and we do, I'm trying to watch my time here to make sure that I'm doing okay. And you just need to mix up their food and have a lot of feeding stations, but don't let them just pick out their favorite, because these guys will just eat the fruit and nothing else. We have a diet out there. We have a protein supplement for sugar gliders made by the Wambaroo Company of South Australia. There's also some sugar glider foods marketed that have made, they call it HP Wambaroo or Wambaroo, something or other, whatever, and it has nothing to do with the real Wambaroo. They're just calling it that, and those are not good. So you can get the real Wambaroo high protein supplement for sugar gliders. I have used this product since 1997 for these guys. It works great to add to the leadbetters and to the insectivore diet, and they do really well. So there are diets that are appropriate in the 6th edition of the Exotic Animal Formulary, the Carpenter book. There's a really good chapter on sugar glider that's got the diets. Go for that. It shouldn't be a problem to feed these guys as long as you stay away from the internet. Okay, handle them without getting bitten. That can be an issue. A lot of our little hand-reared sugar gliders are really pretty sweet. You can keep them in a little pouch and pick them up and hold them just like they were a little bird of the same size, like I'm doing here with this guy. This guy is not sedated or anything. He's laying on a warm thing here, and he's like giving up trying to bite me because I told him no, and he grabbed my hemostats, and he's very pleased with himself because he's holding. I couldn't get those away from him, but he was pretty happy. These two little guys, somebody brings them to you, and they will do this. They vocalize, and they'll yeah, and they do this thing called crabbing, where they sit and then they rock back and forth on all fours and hiss at you at the same time. Yeah, throw a towel over them and grab them like they were a little bird. But they think they're really tough doing this crabbing thing, and they will bite you when they're doing that. So, okay, positioning them for x-rays or for any other imaging is basically the same as for any other small animal. Yes, this picture is flipped. That's okay. But you can see, I think you can see that gliding membrane, the patagium running. It's, well, I can see it on here. Anyway, to give injections to these guys, I use the front of the big muscle mass on the leg. You can also give it to them in the biceps or triceps. To get subcutaneous, we use the flank, but remember that all the fluids may puddle down in the bottom of that patagium, warn an owner that there's going to be fluid buildup there, and that's okay, it'll absorb. Blood draws, there is a nice little medial saphenous vein that's very tiny and you can get a little bit of blood out of. I'm not very good at that. A lot of people use the jugular vein. I am really not good at that. I tend to use what's called the cranial vena cava, where this is the I hope no one's squeamish, but the jugular veins come down like this, and the veins from the arm come down right here. And this is the sternum, and you feel for this little notch in the first rib, and you go in here and you get right into the vena cava, and you can get a good blood draw very quickly. I only do this with sedation. This is the same draw I use for ferrets, for guinea pigs, for rats. Once you get good at this vena cava draw, you can get a good sample really fast and you're done. And that's the whole important part of it. And when you go in like this with a very small needle, you are nowhere near the heart. You're right up here in the vena cava. Do practice on a dead one so you get your method down. But I do sedate them with midazolam prior to do this because I don't want them wiggling. But it's, to me, that's the best and quickest blood draw for sugar gliders. Now, sugar gliders are feisty little critters. They are very particular about who they associate with. They fight, sometimes to the death, with other males. Males will fight other males when they're defending a territory, or if you're housing them and they don't have enough space, they get into battles because they need a lot of space to fly around in, and they're very, very active. But they'll come in with an arm chewed off here, a leg. The owner brings you the leg and says, "Can you put it back on?" No. They will come in completely chewed and comatose. Eye injuries are really big in the males. You know, you saw those teeth when they bite each other's faces, right into the eye. Had this one come in that another glider had literally chewed it right here. It was hanging on by skin. They can be horrific what they do to each other. And part of the problem is that owners may not know they have two males together in a small bird cage. Yeah, it does not work. Okay, their GI tract, like we mentioned before, is pretty simple. This is the cecum sticking out here for gums. This glider didn't get any gum, and this was all infected, and it was a mess. They get various different internal parasites. Biggest problems usually the diet on these guys. When they strain, they may prolax that rectum, all sorts of stuff. E. coli and Clostridium. Clostridium from all that sugar nectar stuff, if it's not fresh, is a problem for these guys. And Symplicimonas. This is a protozoa parasite that is mobile. When you see it on the microscope slide, it swims. It is associated with what they call ick in the babies, but ick in a pouch baby, isn't necessarily diagnostic for this parasite, but the babies will have diarrhea. Some of the adults will carry this and may or may not ever be sick. We do know how to treat it, unlike, again, the internet saying, oh, if they have it, you have to euthanize everybody. No, you don't. You treat, and you do good hygiene. These are these sticky, icky babies. Mom's not cleaning. They got diarrhea all over their fur. They smell funny, and they're sick. They're dehydrated. They're in pain, and they've got gut cramping, and they can't absorb food. I want to put this up here because they do manufacture marsupial teats to use when you're hand feeding marsupials. These are the sugar glider ones, are really little, but they're these long, weird teats. They're different than for what you buy for a puppy or a kitten. You can get these, same place you can buy the Wambaroo high protein supplement. Tritrichomonas, again, a lot of the breeders, oh, you've got to euthanize them. No, you can treat them. Treat with fluids. They got diarrhea. Clean them up. Use chlorhexidine or baby shampoo to clean the kids. Dry them so that they don't get cold, and then treat them with metronidazole. Sugar gliders do have a number of skin problems. A lot of it has to do with diet. They also can have hormonal things. This is an older female who's actually got a pituitary tumor going, but she's got ovarian cysts. They can, anytime you see a glider with a coat that is unkempt, just think they're sick. They're just not grooming appropriately. But you can have thinning hair from thyroid. You can have any of those scent glands be impacted. One of the most common things that were presented with male sugar gliders is for distended necrotic penises. It usually means they have a urinary tract infection and they've had it for quite a while. The penises are necrotic. You can take them off. The urine comes out here, not out here. So we take these off, but assume that they are very sick. They're septicemic. Get them on injectable antibiotics and fluids and supportive care. And a lot of these don't make it, just because by the time you see this, they've been so sick for a long time. They can obstruct and the bladder can burst. They can have all sorts of urinary tract infections, everything from stones to just regular cystitis. And you basically work these guys up like you would work up anybody else. It can back up for kidney disease, especially as they get older. Getting a urine sample is kind of tough because you don't want a sample that has gone through the cloaca and hit reproductive stuff, but also hit feces. So you want to do a clean sample, which is usually from the bladder directly as a cystocentesis. You have to do it with ultrasound guidance. You cannot feel that little thing, and you will get just a tiny amount of urine out of it. This is a small animal, may weigh 135 grams. And so you may get a quarter of a cc if you're lucky on urine, but I have to do it with ultrasound, and then I can find the bladder and do it properly. That hurts, so they've got an analgesic and a sedative on board. Don't just stick needles into things, it hurts. Okay. You guys are probably more familiar with Monodelphis domesticus. These guys are really cute. These are the Brazilian or the gray short-tailed opossum, and they do have marsupial bones, but they don't have a pouch. So they're used a lot in lab animal for development because all these little fetuses stick to the outside. Now, this was my pet, and she didn't have babies, but they all stick to the outsides. And if you go into the lab animal literature, there are pictures of these little tiny fetuses sticking to the, anyway, they make wonderful pets. They should be solitary housed, but you can connect cages with tunnels just so long as they can escape from each other. They're a lot of fun. They are native to Brazil, Bolivia, and Paraguay. They're fairly small. They definitely make nice pets. They adapt to the human caging and like, yeah, they're supposed to be nocturnal, but Maggie, she would be up whenever we were up, and she was just a lot of fun. They're good escape artists. The diet can be a little tricky, simply because they're omnivorous insectivores, and we have problems with people just deciding that an insectivore needs to eat cat food. No, 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 no. Cat food and ferret food and stuff is too high in fat. There is a fox diet made by the Nebraska Zoo diets. That's what they feed the lab animal colonies with, is this fox diet. And then they add a little bit of fruit and a little bit of other things that you chop all together so they can't pick out their favorite stuff, which they will do, and then give them treat foods. But the basis of it is this fox diet. Now, I did Maggie just fine on the Reliable Proteins insectivore diet, and I've done a number of the short tails with the insectivore diet and then adding in all the rest of this stuff the same way, and that's worked fine because the fox, this Nebraska diet, you got to buy it in like 50-pound bags for one little bit. No, not doing that. Most common thing I think we see is problems with the GI tract in these guys, and most likely rectal prolapse. This is kind of a common thing, and a lot of marsupials will strain and they'll pop that rectum right out of that cloaca. It can kill them if you don't fix it, but it can also mean that there's something going on. They've got hepatitis, they've got tumors higher up in their GI, they've just got enteritis and are passing gas and are irritated. It may not tell you what is going on. And then we do see kidney infections with these guys too. Now, when you fix a prolapse in any marsupial or bird or even reptile, anything with a cloaca, with a collecting pouch, basically, you do not want to do what they teach you to do with dogs and cats and all the other mammals, which is put a purse string around here and zip it and pull it tight. No, no, no. The cloaca has to move and it has to do stuff. So once you've used sugar and cortisone, whatever, to get this to retract, then like in a bird, you put 2 vertical sutures across to hold it in, being very careful not to hit any of the structure of the cloaca itself. So you repair them basically like you do a bird. They do have a lot of tumors. That's one of the reasons they're used in lab animal. I won't go into all the different ones that they have, but they have a lot of them. And in basically any short tail over about 2 years of age, it's very common to have a tumor. They also can have atherosclerosis and hyperlipidemia and hypercholesterolemia. Another use for them is a lab animal, which is another reason not to feed them cat food. It's too high in fat for these guys. Okay, I think we've got time to quickly go on here for just a tiny bit for the big marsupials. The biggest thing that you're going to run into probably in the wallabies and the kangaroos is something they call lumpy jaw, which is essentially an infection of the bone from the teeth roots. Wallabies, it's really cool. Wallabies erupt teeth molars, their cheek teeth, from the back, and they move forward and fall out when they're worn. If in captivity they don't have the right roughage, they don't fall out and they sit in there, and then everything gets infected and it's awful. These in a while, these are the two lower incisors. They're huge, and here are all these upper incisors. And I'll show you a picture of that. This is working with a Tamar wallaby. Okay, so here's an x-ray of what happens when that front tooth doesn't move out. It sits there all infected, starts moving to the side of that great big incisor, and you get this draining infection tract in here, and it sets up all this inflammation with the bone. Here's a wallaby that came in that had worn off its top. So there's 6 upper incisors and 2 lower ones, and it had damaged and broken and worn off these. These were infected, and then the lower ones weren't tracking right, and it had been eating a lot of inappropriate dietary things like toast with honey, and this was all eroded in here from like cavities. That's not appropriate wallaby food. But we do treat these basically like rabbits as far as working with the jaws and the bone, and you've got to be very aggressive with them. They also have a problem with toxoplasmosis. So if you have your wallabies outside and you have stray cats that have toxo, they get very sick with it. They can die with it, but we do have a treatment for it that can work. We do see coccidia in these guys, and we do see a lot of hand-reared joeys with yeast infections because they're being fed food too high in sugars. The other thing that is kind of worrisome is tetanus, and a lot of the outdoor housed big gray kangaroos and stuff in captivity can contract tetanus. They jump on, I don't know, rusty nails, who knows, in the pasture, they're outside. We do vaccinate a lot of these guys for tetanus, and we use the equine products. Also, if they come down with it, we use the equine antitoxin. And I would say my success at pulling these guys through once they're already seizuring and have tetany is about 50%. I've managed on a couple of them, and I've lost a couple of them. So basically, to summarize, a lot of the problems and diseases that we see in captivity are due to inadequate diet and husbandry. Most veterinarians are not familiar with the anatomy and physiology of marsupials, and they're also not familiar with the specific medicine and surgeries of these guys. Raising infants can be very difficult. As far as zoonotic type things that you need to worry about, Sarcocystis neurona in the Virginia opossums can, of course, cause fatal disease in horses. And so a lot of horse people, especially in the eastern US, really don't like opossums because of the Sarcocystis problem. The horse has to eat opossum feces with the Sarcocystis protozoa in them, and toxoplasmosis from the cats. It doesn't, the kangaroos and wallabies are a dead end for that, but toxo comes up, they don't shut it. And then remember too that in a lot of places, at least in the United States, they're considered, Virginia opossums are considered wild animals, so that you're not allowed to have them. Sugar gliders they're illegal in some states because they're worried they're going to get loose and terrorize the ecosystem. Whatever. There may be legalities in certain places for you not to have some of these different animals. This is my husband with Jenny. You know, they love to snuggle. It's very cute. There are a lot of materials out there for veterinarians if they would take the chance to do it. This marsupial nutrition book covers Virginia opossums really well, and I love this book. Anyway, so I'd just like to acknowledge, if you want some more information on sugar gliders, the chapter that I have in Quisenberry in the newest of ferrets, rabbits, and rodents, and the exotic animal formulary. I wrote with Grayson Doss the chapter in the 6th edition. In March, I will let you know, for those of you who are wanting more veterinary information about marsupials, Veterinary Information Network, I'm going to be teaching a 4-week marsupial course, 90 minutes a week. So there will be lots more individual things about the different, not only the different marsupials, but much more in depth as far as their surgeries and their care. So I want to thank you all very, very much for having me. And I'm not sure how you guys want to handle questions. And I think I made it on time.
Sharing with us your extensive experience. So before we go into the questions, voy a permitirme a leer parte del currículum de la doctora Cathy.
Okay. Yeah, do you guys want to say them or write them in the chat thing and I can answer?
Yeah, in a few minutes, we're going to listen or to read the question for you.
Okay.
Okay. La doctora Cathy Delany-Jonhson se graduó en la Universidad Estatal de Washington y practicó la medicina aviar, exótica y de animales de laboratorio por más de 30 años. Es miembro fundadora de Washington Ferret Rescue Shelter. Recibió el premio Exotic of the Year en 2008 y el Osco Exotic Mammal Health Award en el 2009. Es consultora de zoológico consultora de NW Zoological Supply y actualmente cumple un mandato de 3 años en el Comité de Recursos Educativos de ALAS, la Asociación de Estados Unidos, y en la Junta de Revisión Científica de la AWMA. Es editora adjunta de Journal of Exotic and Pet Medicine, en y moderadora del foro de especies exóticas. Autora principal y directora del libro de textos, como por ejemplo el Ferret Medicine and Surgery, que publicó en el 2017. Muy bien, pasamos a preguntas. Por favor, si quieren alguien del auditorio presente, ¿alguna pregunta para la doctora Cathy? ¿Alguna duda o algo que más quieran que complemente con respecto al tema? ¿Podría disponer de la presentación de alguna manera con ustedes o con ella? Que está muy completa, está muy interesantísima todo. Todas las pues eso. ¿Se tiene alguna? No, ella la tiene. Ok, lo que es el video como tal, la presentación, no la estamos llevando, pero tenemos la presentación e información que nos compartió en el PowerPoint. Eso. Ok, y con gusto podemos compartir la presentación, ¿no? Que nos trae información. ¿Alguna pregunta? Ahí, por favor, si nos ayudan con el micrófono.
Hola, gracias. Nada más en el momento que mencionaba los sonidos de Miguel, sí he escuchado los chasquidos pocas veces. Quisiera saber por qué lo hace. No sé si lo dijo en inglés, pero yo no supe si dio la explicación. quisiera, no el llamado de su madre, no, el chasquido que hace el de, es específico, no he sabido el por qué.
Okay. And you guys want to know why in what moment opossums make sound? It's a alarm sound. It's a calling sound.
What the one where the males walk around going?
Yeah.
That's looking for a girl. That's looking for a mate. They do when they're fighting. They go. But the males, when they just walk around clicking, it's usually because they're looking for territory and looking for a mate. And it's just a click that they do. They scream too. I mean, they will squeal, but it's not alarm. It's the I've heard pet opossums though who are fussing with their owner, fussing when you're holding them, will go too. But for the most part, that real click is a male
So,
looking for.
basically, for mate.
Pardon?
For mate calling.
It's a click. Yeah, it's a. I don't know. I can't do male opossum. It's real. It's a click. So.
Thank you. ¿No hay questions? Básicamente lo que ella comenta es para producción, para apareamiento. Es un planeta para apareamiento. Sí, hay una pregunta.
Bueno, my question is, how opossums became pets in the United States? Can I buy it like opossum, or I just get it from the wildlife?
You can't. Well, I will say this. I think if you go onto the internet, you can probably find some breeder, somebody who is selling baby opossums that they have taken from the wild, taken from a mother. I am not aware of anybody successfully breeding and raising them for the pet trade. But that said, I'm sure somebody is doing it if they have the chance. The ones that I see up here are all from hit by a car rescues from the moms. They're all orphans. And in our state, technically, it's not legal to own any animal native to the state. But they were introduced, so they're not exactly native. So our fish and wildlife people are like, we got bears to worry about and cougars and, so your opossum, they're not too concerned. And also I will say this, that opossums do not have rabies. So you don't have to worry about that. I mean, we don't have rabies in land animals here anyway, but they don't have rabies, so you don't have to worry about that. But I'm sure you could buy them somewhere. It's it's not how I get mine, but.
And how common it is to have it? How common?
Pardon?
And it is common to have pets, in your medicine area, you have a common pets from opossums, or they are one
we have an awful lot of orphaned opossums that are rescued from the moms being killed by a car. So we have, if some of the babies we can re-release, and do great. There are other ones of them though that want to be pets. And so mostly what I work with is the rescues and then the pet ones that were hand reared. Now, that said, and I did not put it in this talk, but I will in the March talks. Baby teddy bear doll clothes fit them beautifully. And I have a lot of people who bring their opossums in dressed up in costumes and things and outfits. And yeah, I have a lot of cute opossums dressed up, and I even have my own with the Christmas hat on, and he's like, whatever. So you can dress them up. They don't care. They love to snuggle. And actually they make the ones who want to be pets are great. We had one little rescue boy this last year that would have none of it. He was like, nope, not doing that. And we had another one that we released that has stayed around where she was released, and she's still there. And so, let's look at it this way from an opossum point of view. They're kind of lazy. And if you have your food and your bedding and everything right there, why would you leave? They're very food motivated.
Thank you.
Thank you.
I think there is a question in the chat. Can you read it?
Pardon me?
There is a question in the chat.
Yes, I just answered that with the reason for the development of cancer. Well, it's like any other animal. We see liver tumors. We see all sorts of different kinds of tumors in these guys. We don't know the reason, for the most part in anything. So we see all sorts. I think liver tumors are very common. Reproductive tumors are very common. Skin tumors. I've seen a lot of different ones, and it's just old animal thing. Opossums get arthritis as well. They can get very creaky as they get older. But again, in captivity, they live a lot longer than they do in the wild, at least in our area. 2 winters is not a long lifespan, whereas my last opossum lived 5 winters. She was old. She was almost 6 years old. So,
Another question? Yeah.
Hi, Doctor.
Hi.
We're getting a bit confused. So far, we've learned from the first day that opossums, they're very good disease reservoirs for certain parasites. And as far as we knew till today, till we met you, was that it's okay to have pets as opossums as pets. So we're just wondering, what is the protocols, like if all the information that we got here so far about the diseases, what is the protocol that you use to make sure that the babies aren't infected with those diseases, and how could they affect the people that they're around with? Because I know for a fact that they're attracted, or the ticks, or the parasites bind to the opossums, and they could be a way to spread certain diseases like Lyme disease and Chagas disease.
Okay.
So, what is the protocol that you use?
We, first of all, for ectoparasites, for ticks, fleas, all that, we use cat topical, like Advantage or Revolution or Frontline, any of the topical anti-parasite formulas that they use in cats for the same body weight, and we put it on monthly. So they don't have ticks or fleas when they're in your house. I mean, and any babies that come in get bathed, they get defleed. Like I said, as soon as they're eating well, we treat them like kittens as far as with selamectin or moxidectin or any of the cat anti-parasite things. For internally, we treat them with ivermectin, fenbendazole, prasugrel, all the same things that you worm dogs and cats with routinely. As far as ringworm or anything like that, well, it's pretty obvious if they have it or not. You can treat them just like you would a guinea pig if they have a dermatophyte. As far as intestinal bacteria that could be a problem, again, most of these guys we run through amoxicillin just because chances are they've got bacterial load from the mom or from whatever. So we run them through a 2 to 3 week course of a broad spectrum antibiotic. And I have one thing that I've done is there is a test called MyDog, MIDOG, that is a next generation PCR. And what you can do is take a swab up the rectum, up the vent, and send that in, and it will type out every single bacteria and fungus and yeast that is in that animal, that's in the feces, that's in the gut. And so far, I've not found salmonella, I've not found shigella, I've not even found Campylobacter, have from ferrets, but not from that. Salmonella is the biggest one that everybody worries about. If your opossum has salmonella, chances are it's going to be sick. And I just haven't seen salmonella. Clostridium, some of the Clostridiums that cause problems, again, the opossum will probably be sick with diarrhea, and you can treat and work with that. But just your general baby screening, as I outlined there, for parasites, amoxicillin, broad spectrum, doing your diagnostics, and really, at least up here, first of all, I have never found ticks on an opossum here in my state because they eat the dang things. We have a very low level of Lyme disease, and the opossums, as far as I know, in the eastern U.S., where Lyme is a really huge problem because they eat the ticks, they don't seem to carry Lyme. They don't. I guess their gut destroys it or something. I don't know. The opossums are not a reservoir for Lyme disease. They're not a reservoir for anything that I know of except Sarcocystis neurona for the horses. So most people who are horse owners don't want opossums on their property pooping on their horses' hay. But other than that, as far as a zoonotic, raccoons I worry about. Opossums I don't worry about. So I hope that answers your question. It's kind of like taking a kitten and working it up for everything, you know. So I hope that answered your question.
Yeah, there are many questions, Cathy. But we have other activities in the Congress. So I want to thank you again for your conference, and I hope you can join us in the next Congress in the future.
Okay.
And surely many people that hear your conference will be asking you many questions in the future. Thank you very much for your time and for joining us in this conference.
Right. Thank all of you.
Okay, bye.
Bye.
Muy bien.
I'm going to...
Hacemos ahorita un break para iniciar con la primera mesa de la sesión del día de hoy. Gracias.